Great stuff. Well, I think we've almost got all the people we were expecting. So yeah, without further ado, how are we doing? Good afternoon. Yeah, and welcome to this this afternoon session of a breakout session on creating good jobs. So I'm Lloyd Goodwin, I'm Associate Director of Policy here at CLES. So yeah, there's the purpose of this session. It's a breakout session, but it's really looking at how we can use opportunities, employment opportunities within anchor institutions to start to address poverty, deprivation, and inequality, and really start to reach those furthest from the labour market. So I'm delighted to be joined by three fantastic speakers here this afternoon. We've got Councillor Bev Craig, who's of course leader-elect of Manchester City Council. We've got Sandra Jones, People Development Lead from the Northern Care Alliance Group, and we've also got Sharma from West Birmingham, Sandwell, and West Birmingham NHS Trust, who works within the Trust's widening participation project, where Nav is a project support officer. I'm going to keep it pretty brief, and we will get things going in a moment. I've got a little bit of housekeeping just to get out of the way, like this morning. Slightly different, it's not a webinar, it's more like a normal Zoom call or Teams call. We are recording the session, so if you don't want your audio or video to appear on that recording, do switch your camera off and keep your mic off at all times. We will ask you to keep yourself on mute when people are speaking, if you don't mind, but we do want to hear from you, of course, so please use the chat function here to let us know who you are, where you're from, say hello. If you've got any technical issues, you can use the chat to kind of raise that, and one of our tech support team will come along and give you a hand. Also, as Sarah said this morning, we're trying to get people to reflect throughout the duration of the summit, really, on learning and what it is that they can maybe put into action. So if you come up with a kind of like, I'm going to do this on Monday type scenario in your head, then hold on to that, and we're going to post a form in the chat now where you can kind of declare that, as it were, and we may ask you at the end of the week to just kind of mention it at our closing session. We might bring you in and you can just kind of say what your to do on Monday will be. In terms of how we'll run the next hour or so, then I'll start with a brief bit of context setting. I'll get people to talk for around 8 minutes. That should take us to around 2:30, and then we'll break out into 3 groups where we'll discuss the inputs that we've had. Really want to get us to kind of focus on, reflect on what you've heard, but then think, what examples of good practice do I have in my particular area? How are we working with other partners in this space? What might be the challenge in scaling this up and amplifying it, doing more to use employment to really connect to those furthest from the labour market, and as I say, really address poverty, deprivation, and inequality. So and then what we'll do is we'll come back at 2:50, and then we'll have 15 minutes to discuss. We'll get each group to reflect, and we'll have 15 minutes just to kind of discuss what we've heard. So let me just do a brief bit of context setting then. There's a claim around at the moment then that unemployment has peaked, and we know that there's record vacancies, for example, in some sectors. But we know that youth employment in particular is going to be a painful hangover from COVID-19 as we undergo that kind of recovery, wider economic recovery. We've got interventions at the moment like Kickstart, and obviously they should be helping young people who are at greatest risk of long-term unemployment to transition into new jobs. But Kickstart essentially is very much a market-led intervention, and it allows prospective employers to really start to cherry pick certain cohorts, like young graduates who appear to offer more value for money, and kind of, as a result of that, it might mean that those in need of greater support are being overlooked. But to address the shortcomings of things like Kickstart, we're seeing some really great stuff emerge from our anchor institutions to start to lever employment opportunities towards those people who are currently furthest from the labour market. I'll shut up there, and I'll hand over to our speakers then to give us their contributions about what they're doing in their respective areas. So Bev, if we could start with you, that would be brilliant.
Thanks, Tom. So for those of you that don't know me, my name's Councillor Bev Craig. I'm currently the Deputy Leader of Manchester City Council, soon to be leader from the 1st of December. and I've been on our executive covering the health and care portfolio since 2017 before becoming deputy leader this year, where I've been leading on our finance, resources and capital projects. So I suppose I was hoping to touch on three key areas. And for anyone that's heard me speak before, you'll know that 8 minutes to me is quite a significant challenge. So I'll take the nod from Tom when I've hit my 8-minute mark. But I suppose from my perspective, I want to touch a little bit around the context of Manchester, because I think that shapes a lot of what I'll come on to talk about afterwards. So from my perspective, obviously the City of Manchester, we've taken a long-standing ambition of becoming a world-class city that's internationally renowned and competes on a global level. Obviously, we've been dealing, I think, even to this day, some of the legacy of the issues that we faced in the 1980s and 90s, where we had a post-industrial city in decline, where residents were looking to move out if they could of a city into the Manchester that we see now, which is one of the fastest growing cities in Europe, and one of the youngest cities in the UK, with a growing population that's set to rise by almost 80,000 residents in the next decade. But within the context of Manchester, we're still, in terms of some of the challenges we face, we're still the 6th most deprived local authority area in the country. We still have a shameful situation where over 40% of our children are living and growing in poverty in our communities. And we've seen significant challenges coming out of COVID that I think have really hit on some of the existing inequalities, both of health and wealth, that existed in our city, and really, I think, fundamentally exacerbated them. We know our city very well, and I would point you to anyone that's interested in further reading on how we intervene in our area around the state of the city reports that we do each year, because actually behind that is what leads me into the two key points that I want to make today. I think, from my perspective, I'm not here to talk about the work that a city council does. I'm not here to talk about an individual organisation. I'll come on to some examples in a moment after that. But actually, the role of local authorities, the role of councils and place leadership, I think is absolutely fundamental when we talk about these issues, because actually the intervention that a local authority can make if they see themselves just within the confines of a single organisation is much, much more limited. So within the context of the city, we've taken a long-standing view as to how we can bring jobs and investment into the city. But fundamentally at the heart of that has to be around Manchester people being connected into those jobs. So in terms of the economic growth we've seen in the city, we've seen, I think, a significant, over the last 10 to 15 years, growth in what some would call, I suppose, high-skilled sectors. Now, the challenge that we have in those sectors isn't around the quality of work, isn't around the level of pay. It's around our working skills agenda that we've worked really hard on to make sure that we're connecting those opportunities to children and young people. An approach that's began with our early years work, that's worked through primary and secondary schools into FE and further into apprenticeships, but obviously also linking into our universities, thinking about graduate, not just attraction, but retention, thinking about Manchester people that can go to university either in the city and come back, and making sure that actually they live in a place that they want to call Manchester home. We're now in a situation where we have above the national average of level 4 skill level qualifications, just under the 44% of our residents. And that brings me back to the disparities and the challenges that we see in dealing with some of our more broader population. The area where we have perhaps the biggest challenge, if you set aside the longer term approach that we've taken around our working skills and education teams around getting Manchester people into those well paid, good quality jobs in new sectors, has been around how we think about the foundational economy. And obviously, you know, these are the jobs that the vast majority of residents who are paid beneath the real living wage occupy themselves in. And we've done, I think, to an extent, interventions where we can, that I think we need to really refocus, not just as Manchester, but across the piece, what it looks like for supporting, engaging and intervening with the foundational economy. The stuff that I'll talk on includes, for example, around our commissioning. So one of the first things I did as executive member for Adults Health and Social Care was to move all of our home care workers up to the real living wage. Now, I'll be honest, that involved Manchester City Council putting extra money into the contract every year. That wasn't something that we could encourage the sector or the market to do on its own. And that probably leads into the broader agenda, some of the big things we're doing at the moment around what a living wage place is, but also talking about living hours, also talking about good employment, using the leverage that we have where we can to encourage bits of those sectors to come on board with this. And I recently launched our ambition to become a living city place back in September. What we see in the city and what we know about it is we already have 130 accredited real living wage employers, but we know there are many that pay that who aren't accredited. So for example, in the cultural sector, from the survey we did, we know that 85% of employers in the cultural sector pay it but aren't accredited. So there's work coming forward with our anchors pilot as to what that looks like in the new year, as to how we become a real living wage place. I think I'd also say, just before I come on to a specific example of how social value and procurement of an organisation can make real and lasting change to communities, is seeing all of this in its round. So from my perspective, seeing the work we're doing to attract good quality jobs, the work we're doing around working skills, that it's also connected into our anti-poverty strategy in the city. We've recently refreshed our family poverty strategy, and we'll see more of that coming in the new year. So the final thing that I wanted to touch on is around the practicalities of social value and procurement. And we've worked with CLES over a long-standing number of years around how we can take forward the social value agenda. Early doors, we moved 20% of our assessment criteria to social value. We've since added an extra 10% around the criteria that we use for the environment in terms of our zero carbon. So we see our sustainability and social value agenda accounting for 30% of what we ask for in terms of contracts, and that's applied across a piece. The work that we've done with CLES in terms of our spend analysis shows that, say, for example, in 2019-20, we spent just over £500 million with our 300 top suppliers. Almost 70% within those top 300 suppliers were with Manchester-based organisations. We've increased the number of spend with our SMEs, and we also estimate that that top 300 spend redistributes an extra £143 million back into the Manchester economy for employees and suppliers that they generate themselves. It created an additional 2,250 jobs with over 55,000 hours of volunteering and over 6,000 opportunities for people, I suppose, previously deemed hard to reach within Greater Manchester, and created over 576 apprenticeships. So the final thing that I'll touch on before I get the gentle nod from Tom is particularly around one project in particular, and that's something that we can see going on at the moment. So Manchester's Town Hall, the civic heart of our city, was something we had to take a very difficult decision, particularly in the context of austerity, to invest a significant amount of capital money, over £300 million. And we've been really, really firm with that actually, as a key part of that, particularly after a decade of austerity, particularly as we come out of COVID, has to be seen to be something that continues to put at its heart our social value and procurement commissioning. So we set ourselves some base targets, for example, around local employment within the scheme at 30%. We've exceeded that at almost 50%. We set a target of 40% for Manchester spend. We've exceeded that with over 60%. And we set ourselves some pretty strict targets in terms of what we can do around apprenticeships and access from FE and HE. And we've excelled with that and are on track to overmeet. So what I would say is the final two things. The first is that you can achieve, I think, interventions in a place, and that local authorities should achieve interventions in a place, but by taking a long-standing view over a period of time that won't necessarily see the quick interventions that you hope to see, that doesn't bring you immediate rewards, but sticking with that and seeing that in the longer term in terms of those interventions. And I think within that, checking with your stakeholders that that's what you want to continue to achieve. We've consistently done that with Manchester People, and they've given us resounding messages to carry on with it. And then the final thing I'll say is be brave in your partnerships. So coming into politics, one of the things that perhaps has surprised me is where you find that passion and energy from sectors that you might not have always expected it to come from. So I certainly am taking the view that, you know, anyone in the city that wants to come into our city and do business, that wants to work with our core values around making sure that we make Manchester a better place, bringing the people that need to benefit from growth the most into the fore, are people that we'll do business with. And the final thing I'll say is it may just surprise you along the way who some of those people are and where their passions come from. So I'll end there, but happy in a broader discussion to cover any more of that in detail.
Thanks so much, Bev. Yeah, I think it's that really, you know, it's that example of how we have to make these interventions. We can't just rely on kind of the fact that kind of cities like Manchester are kind of growing rapidly, and we can't, you know, it's not just going to deliver opportunities on their own. You do have to do the things that Bev's describing there if you want to make a difference for residents. So that's great. Sandra, can we bring you in next and hear about the experience from the Northern Care Alliance about what you're doing around employment?
Yeah, absolutely. Thanks, Tom. For those of you, I'm sure you've heard of Northern Care Alliance. So we have the umbrella, so we work with 4 hospitals, got 18,500 staff, and we currently look after over 1 million patients across our unit. So quite a big organisation. But one of our objectives this year, which is fantastic, is to look at pre-employment programmes. And what we want to do is have a target of 1,000 starts by 2025, which is working with pre-employment programmes, Kickstart, whatever programmes we can to get young people to come and work for the NHS. So Kickstart, for us, it wasn't just a tick in the box. It was about actually bringing young people in and employing them into the NHS. We've got old fogies like me at one end, but we unfortunately don't have the young people at the bottom end that are coming through. So for us, it was about making opportunities to bring in those young people. We employ them for 6 months. We give them 7 days of personal development. We pay them on the agenda for change, so we pay them more than minimum wage because it's the right thing to do. If we're expecting them to work, we need to pay them for the work that they are doing. They get a senior manager as a mentor, and we also guarantee them an interview if there's a band 2 role across the NCA that they want to come and work to. They also are under the same terms and conditions as everybody else in the organisation, and they're our colleagues, you know, so we don't call them, you know, work experience or placements. They work with us, that they're one of us. We spoke earlier, I think Tom mentioned that occasionally some of these programmes people cherry pick and they look for certain types of people. For those of you that know the NHS, to actually apply to get a job with the NHS is a bit of a nightmare because you've got an application form to do, you've got a lot of pre-employment checks to do, and we are governed by those. So a lot of those we can't change. You know, if you're going to do a patient-facing role, we have to do DBS and ID checks and everything else. But what we did for this programme is not actually interview experience and qualifications. So normally, if you didn't have those, you wouldn't get through to an interview. But actually, we went for potential. So we were looking for young people who we felt had the potential to be able to work in certain areas. So some of those areas were in the care setting. So they could be on an acute ward, they could be in therapy, they could be in working out in the community, working in scheduling, HR, all sorts of different roles that we had. And for us, it's worked. Because what we found is if you speak to a young person and ask them why they want to go into care, what experience have they got? A lot of their experiences has come from they've not perhaps had the best upbringing and they may have had to look after an elderly patient, a brother or a sister, and they want to make a difference, which for us has been fantastic. You know, and I always look at it thinking, actually, would I want this person looking after my mum? And the potential of those candidates is absolutely, yes, I would, you know. We had one young lady who came to interview because we want to be real, you know, it's not like casualty, it's, you know, real lives, real people, they have to do and see things that they've not done before. And we asked how she would cope if there was a death on the ward, what would happen, you know, with this patient. And this one young lady just turned around and said, I'd hold her hand so that she wasn't there on her own. Now, to me, A, I cried, but B, that is the type of people that we want working in our organisation who have got those values and beliefs to move forward. And one thing that we've also done is we've found that some young people aren't quite ready, because obviously working with patients, we have to make sure that the right person to go and do the care. So if they're not ready, we actually offer them one of our pre-employment programs. So we look at actually what else is available that might just give them either a bit of confidence or look after anxiety or talk about getting into work, so that we can then transfer them onto the Kickstart program to gain employment further on. So to do this program, we work in partnership. So we work with the Prince's Trust. So before they come to us as an employee, the Prince's Trust do a 2-week program with them. And that's working in conjunction with us, making sure they know what our values are, our beliefs are, and anything to help them in their employment. So as I spoke before, we give them a senior manager, so most senior managers is the chief nurse, we've got chief people. And what we say to them is use that mentor as much as you can. Find out how they've got to the job they've done, find out how they can help you. So we talk about what being a mentor is about and a mentee, because a lot of young people haven't got a clue. So we ask them to come up with 5 questions that when they have the first session, they can start that conversation. And the mentors that, catch up on, probably get more out of the young people than the young people get out of them, because they can ask them things about recruitment. How could we do this better? How does that work? So the relationships have actually turned on its head, and it's been absolutely fantastic. So we work with the Prince's Trust. Obviously, it's a DWP initiative. And being honest, it's not been the best of relationships that we've had with DWP. And I know it's a national concern with Kickstart, and that our main area of concern is actually getting young people through the door. We just don't get the referrals through. We've got these fantastic opportunities, but unfortunately, we don't get the referrals through. So, not that I'm a control freak, but we actually took control of the programme for our second cohort, and we went out to the job centres. We trained young people, we trained the work coaches, just to get the message out that actually we've got these fantastic opportunities. We also worked with a couple of local councils, so we're on a group so that people know what's going on, because actually, it's not just an NHS thing, it's wider than that. It's, the councils know what people have got in the area. So we need to do a bit more work on it. So we need to do, I think, Northwest councils to see what we've got, so how we can provide for young people. We also are lucky enough to be on a Kickstart board, which is a national board. So you can see what's happening throughout the country and how other areas are working. So from our perspective, our cohort 1 started in April this year and have now finished. And it's amazing to say that 90% of those young people are now employed full-time within the NHS, which is fantastic. We are coming to the end of cohort 2. They finished in December, and at the moment it's roughly around 80% of those young people kept on. And for that session, it's been fantastic, because actually those that are on a ward, we're in the middle of winter pressures at the minute. So, notwithstanding COVID, we also have all the winter pressures. So they've naturally done their 6 months, and then they're coming into a role that they've already done, which is fantastic. We're hoping to, by the end of the year, have 72 candidates that have come through our process. And next year, we are actually looking to go into different areas to look at portering, estates, facilities, so different roles that we can offer our young people. And for me, it's not just about how they come on professionally. I'll give you an example. We took on a Kickstart in my team, a young man called Matthew, who at his induction couldn't give eye contact. He was physically shaking. He wouldn't speak, couldn't tell his name. And at his award ceremony in the end of October, he stood up and presented in front of the whole audience, in front of the chairman, in front of the, well, I was just in absolute bits to see how far this young man has come on. We've now taken him on full time, and he's thriving. So these sort of experiences that we give for pre-employment isn't just about getting them into a job, it's actually what you're doing for that young person and their families. They tell me that my dad took me out for a meal because he was so proud that I've gone through this and I've got a job now. So it's the impact it has, not just on them, obviously it does on me, because I've, but for the wider families. We've got one young man who went to speak at the Conservative Party conference, and he tells me he has discussions with his 5-year-old who thought the only jobs in the NHS were doctors and nurses. The boy had to be a doctor and the nurse had to be a girl. So he's now talking to her about all the 350 roles that we've got to try and help that. So for us, it's been a fantastic experience with the candidates. So we had quite a lot of issues with DWP, but I don't think we're on our own there. But for those that I now call colleagues, it's been fantastic. Thanks, Tom.
Thanks so much, Sandra. Yeah, that's brilliant. It's just that kind of, it's that flip that you've done in the Northern Care Alliance for me. This sense that actually, you know, our approach to employment is no longer about the best person for the job. It's about how can we use the significant employment opportunities that we have to address poverty, deprivation, and inequality, and advance inclusion. And I think it's such a fantastic example of that. And the granular detail that you've given, I think, yeah, I'm hoping that's of real value to other people on this call, because we often get asked, well, you know, how do you do it? And it's kind of, you know, that description there has been brilliant. So thank you. Nav, if we can come over to you, last but certainly not least, yeah, you're doing fantastic things in Sandwell. We've spoken before about this. Yeah, the floor is yours to tell us about what you're up to.
Okay, I'm going to tell a little bit about Kickstart, reiterating what Sandra's said. We too, Sandra, have taken on Kickstart youngsters, but we haven't looked at graduates. We've looked at those that have never worked. But we've been successful because we've got a great relationship with DWP, and this is why these are important. And I totally agree with what you say. So we took the Kickstarts on. We didn't have to find them, DWP did, and they put them in front of us. We interviewed them and kept all of them because there was an opportunity for all of them somewhere in the hospital, in the various departments, especially in our local primary care sector, where they're going to be, where some of them are doing meeters and greeters, especially with the winter months coming up. And if I tell you about one of them in particular, and then you can just understand that's what the rest are kind of like. So the one particular person, she had a child at a young age, and she's got custody of her child joint with her parents. She suffers from anxiety a lot, and she's never worked. And when DWP put her in front of us, and she had said, will they employ me? And they says, well, we don't know, but you've got to take the interview. Now, if somebody of that caliber is able to sit in front of a few people, a panel, to talk about themselves, they've got lots to offer, so much to offer. And she was so excited when we said, yes, we are recruiting you, no matter what, because you've got something that you don't realise what you've got, you know. Myself and my team, halfway through the programme, will be helping them with their NHS application form, what to put in their personal statement, etc. Because, like you said, not everybody knows how to apply for jobs in the NHS. So hopefully, if they're not all recruited, we will find them work elsewhere in the trust. So it is a success. When we link up with DWP, they find the young people. Sandwell College then put them on a 3-week training course for customer service, health and safety, equality, diversity. So they do all of that before they join us in the trust. So yes, partnership working is so important because you cannot do this on your own. So that's one of the programs that we've been instrumental about to deliver. And it does come down to equality, diversity. You know, you say we're a trust of and we believe in, but if you don't deliver, then there's no point saying we are equality, diversity, inclusive trust, which we are. So all right, so I made a few notes while you were talking. So that's good practice on that. We also work on a programme called Live and Work. So we have a building that used to be the nurses' accommodation, where we provide a 16 to 24-year-old accommodation at affordable rent. So they're paying about £42 a week rent. That covers everything. And we offer them an apprenticeship opportunity. At the end of that apprenticeship, they will be then employed as a band 2, and then they progress on. Many of them that have come through this have gone on to senior posts. Now, when I talk about Live and Work, sorry, I forgot to mention, it is in collaboration with St. Basil's Homeless Charity, where Prince William is the ambassador. And he's come down to small West Bromwich and seen where these young people are staying. And I'll give you an example on this, to thinking outside the box. So we put this young person in front of our primary care team and said, here you go, he's ready, you can interview him. So we all sat down and spoke to him, and it was such a shame that he didn't fit the age criteria. He was already 24. So the managers of the primary care team said, right, we are offering him a job, band 2, that's it, we're going to offer him that job. We like what we've heard, we like him, and we need you, that was myself and my team, to find his accommodation. What can you do? So we went to Apprentice House, knocked on the door, spoke to the manager, because we've got a great relationship again, and we said, they'll offer him a job if you can offer him the accommodation for 12 months at least, until he's on his feet, and then he can start working and he'll have somewhere to live. And he's crossing the road from where the building is to the trust hospital, so he's paying no travel costs. There's no travel costs involved. Can you do that? And they've agreed to it. Our apprentices that live in Apprentice House, we do offer them a food voucher for 7 days of the week. Again, for this young person, we said, can you provide 5 days food voucher? They can eat a hot meal in our restaurant. Again, they agreed. If you don't ask the question, you're not going to get an answer. So he couldn't join the apprenticeship team but he's been recruited as band 2, and they said they've got a senior post coming up, 2 senior posts coming up, and they says we want him to apply because we think that's where his caliber is. So within, I think, 4 months he'll be a band 3, and 12 months living, paying £45 a week rent, he'll be saving loads and have his own accommodation by the time he finishes. So and also we're looking at ex-offenders, those furthest from the employment market. It's important that we support everybody. You know, you've made a mistake, you've paid for it. Why should you not do the job if you're capable of doing the job? The programme I work on, which Tom's mentioned probably before, which I absolutely have a full passion on everything that I do, but this one in particular, is the Healthcare's Overseas Professionals. So I work with refugees, qualified doctors and nurses from their home country back into or nearest to the employment. It didn't start off as that initially, but that's what started to happen. Again, if you don't have executive trust board support, you can't go further with these individuals. 5 years ago, I was told to find 60 that lived in the Smethwick and Ladywood area. That's in one of the deprived areas in England. By 8 months, I'd already got 100 registered on the books. This morning I was doing my calculations. 148 are in employment. 48 have got GMC registration. And Sandra, you'll understand that if they're from abroad, how long it takes for them to get that. We calculate an average of 2.5 years. Because they need something called IELTS, International English Language Test. This is what we provide as a trust to all of the clients that are registered on the programme, and then they can start taking their professional exams. We're the pioneer for the medical support worker role. I don't know, Sandra, if you've heard of that. So it's just below a junior doctor. So we're piloting it, and so is a trust in London, as far as I'm aware. And it is to offer a refugee a 6-month post on a band 6 salary. So they will have done they will have passed their English exam and plus PLAB 1. PLAB 1, if I'm correct, is Professional Linguistic something board. I 5 years on, I'm still not remembering what that stands for, but it's a doctor's professional exam. I do apologise, should have been more prepared. So when they do that, they'll, rather than having a clinical attachment where they're just observing, they have a more hands-on experience. Our trust has recruited 15 local trusts around, because they don't have a refugee programme like Sandwell and West Birmingham, have said, we want to do this, support you. Can you refer some clients to us? So local trusts within the Black Country have employed doctors as medical support worker roles, and so have further afield in Coventry. I'm in a meeting tomorrow with our chief nurse. They're looking to recruit nurses from abroad. I've got 18 nurses that are waiting to find employment either as HCAs and while they're studying for their English language test. Like Tom says, the good practice is to get great relationships with stakeholders, partners. If you're not able to do that, you could struggle. But once you have that relationship, you can all work together. And the importance of why, a refugee, every single one that I've met, I don't want to work. I don't want to have benefits. I want to work. If you see any of our YouTube videos, there is a doctor on there who always wants to be a GP. She's actually on her 18-month GP training with us in our trust. And she phoned me about 4 weeks ago and she says, I'm buying my first house. And to me, that's the change it's making. Yes, we look at the news, we look at BBC Channel 4 and we think, oh, they're here now, they want a free ride. They really don't, not the ones I've met. They do want to work. And remember, if they're working in a local hospital, that's where they're going to live. That's where they will start spending their money, and that's important for regeneration, because that's where your town then can grow. So that's where I work on. Thank you for listening, everybody.
Thanks so much, Nav. Yeah, it's brilliant. It's brilliant again. I mean, I think just that, and it's that kind of the depth of resource that you're throwing at it as well. The fact that you're you're thinking, right, what land have we got available? How can we use that to tie into it as well? I think it's inspirational stuff. I hope that everyone is kind of is kind of taking that from these examples. It's brilliant. Yeah. So what we're going to do now is we'll split out into three breakout rooms, if we will, just to kind of reflect, I suppose, on what you've heard there, and be really interested in hearing any of those reflections, any other examples of good practice that kind of similarly you've got in your areas that you might want to share, examples of kind of innovation in terms of working with partners. It's interesting now we've got kind of like a slight divergence. Sandra talking about the challenges of working with DWP, Nav saying, actually, you know what, in our area it's okay. So it's interesting, isn't it? So any more of that nuance would be really interesting to kind of for you to reflect on. And then just kind of any reflections on how we could do more in this space? How do we really start to scale this up and amplify it? So hopefully we'll be getting broken out in a second by our tech leads, but if we could take till kind of just 5-2, so about 15 minutes, then we'll come back and then we will compare notes. And then we should have, kind of an opportunity just to kind of have a final chat before we finish. So I'll see you all back here at 5-2. We'll post those questions in each of your chats as well, so that you've got that. We're coming back there. We were in the middle of something brilliant. Unfortunately, it's always that thing in it when the room closes. Right, are we all back? Let me just look at the. I think we're all here, aren't we? Yeah, that was. No, we were having a really good chat there. I was wondering if we could get one person from each group just to give a brief summary as to what was covered. Bev, which group were you in? Would you mind doing that, or was it someone else that might?
Yeah, no, that's fine. So we had kind of a short but good discussion, I'd say. I think on some of the challenges, probably focused around sort of three key areas. The first around kind of a bit of a reference to Kickstart versus not getting Kickstart and what other opportunities are available there. The second was around picking up on, I suppose it's the broader things that shape someone's life aside from the job opportunities. So access to accommodation, but also support when we're thinking about apprenticeships and new opportunities been absolutely vital. And then the third and final sort of theme was around the balance of not confusing the message versus getting what you need to get out of it. And I think that was in the context of the real living wage, on top of, not versus, access to good employment and good quality jobs and terms and conditions, and how we can move, I suppose, and capitalise on a lot of the work that's happened around the real living wage movement to make sure that we're looking at good quality work in its broadest sense.
Yeah, no, that's great. Thanks, Bev. Sandra, what about your group? Any reflections from your discussion? Oh, you're on mute. There we go.
Isn't it really? Yeah, some really good sort of questions that came through around sort of workforce planning and how do you look for where you want the new jobs to be, because Kickstart, they have to be a new job. You know, it's not just putting them on a placement. So a really good conversation about how we do that. We talked about the resource of managing these programs just happen, and we talked about how, you know, how much you put into it from an organisation perspective. You do get a lot out, but you need to be able to have the resource to do it. Specifically around your recruitment team, they need to be on the ball to be able to help, and also get involved with your, you know, sort of training and development team to be able to do the development sessions. We also spoke about a sort of policy and recruitment approach. So what policies do we use? And for us, we just use the NHS policies and procedures. They go through exactly the same as us, apart from the fact that we just hold the hand all the way through it so that they know that they've got support to be able to get through the application process. And so for some good practice, Kaylin from Corporate UK was saying that they do a lot of sort of partnership work, looking for good quality jobs in the area. And they sort of become a bit of a combined advisor to be able to help to get people sort of stronger jobs, really. So some really good things coming through. So yeah, it's great.
Great stuff. Thanks, Sandra. Yeah, I mean, I think in our group there was there was that recognition just how much places are, well, how much kind of poverty, deprivation and inequality is an issue that kind of like all areas are having to struggle with at the moment, but that there is that real sense of trying to address this through kind of anti-poverty strategies and through partnership work in place. It was great to get some reflections from Scotland about the kind of the power of, obviously we talked about this morning a little bit, those community planning partnerships that exist in Scotland are kind of like, they're almost like already established networks of anchor institutions that are kind of geared up towards doing this. And there is, we talked about the potential to kind of start to tweak regional economic strategies as well, kind of based off the back of the work that some of these partnerships are doing. You know, how can we really make this a priority within those strategies? The mention of a new strategy like that in South Lanarkshire brewing there, which is great to see. South Essex are really kind of on with this as well, kind of really realising their responsibility as a big anchor institution in place. Again, trying to move towards that more skills-based approach and move beyond that kind of traditional advert and interview process that you've managed to do in the Northern Care Alliance as well, Sandra. We also got into mentioning, they were talking about kind of the potential of ICSs actually, so integrated care systems, which are obviously particular to England, but how actually through those kind of discussions that there's a real opportunity to knit some of this together. Some really good example from Suffolk County Council, where actually economic development are very much coming into those discussions. They're linking in with the Chamber of Commerce as well, so trying to use those connections to really address the social determinants of health. So I think that's really heartening to see. But I wonder, just, we've got kind of like 15 minutes left now for kind of a broader discussion. I mean, I'm really interested in how we can kind of take this to the next level. I mean, one question to us all really is as kind of like representatives of anchor institutions and people working in this space. It's like, and we've kind of flagged this in some of our diagnostic work recently, but is there an opportunity, you know, how could we do this across like a total place footprint and bring together all public sector jobs and say, you know, could we take that, could we design, you know, enough pre-employment training programs to kind of play into that total pool and really create a significant resource there to address poverty, deprivation and inequality. You know, how far off are we from that? You know, could we do it, or, you know, is that a bridge too far, do we think? I don't know whether anyone wants to come in and reflect on that. Let me make my screen full so I can see you all.
I think potentially it could be done. You know, we spoke in our breakout about, you know, project working is absolutely key here, which we don't do enough of. I think we start off in silos and then bring people in as and well. And I think another to bear in mind is where the funding comes from for some of these programs, because actually, you know, the funded programs are they want it to be in the local area where they work. And you know, that's what we're trying to do. I mean, I think 57% of our staff now work in the locality of where their job is based. But actually, if the funding's coming from there, it's very difficult then to spread it out. So that could be a barrier. But I think certain things are definitely able to work nationally as a project.
Yeah, Bev, then Kathy.
Yes, so I think it can. I think that a reflection from my perspective in Manchester is that you probably just need to be specific as to what size of space that we're talking about. And the reason that I say that is obviously challenges being specific to each area. So if I think about Manchester, I think about some of the work that we have planned for North Manchester. So an area of the city that's historically had some of the worst levels of deprivation, some of the biggest social challenges, bringing together our anchor institutions in the way that we've done around the North Manchester General Hospital site, our redevelopment bid to government that's been much, much broader than simply just looking at rebuilding a hospital, and then connecting that into development plans that are already in place for spatial regeneration that brings communities with it, and creating almost like a local board that can oversee that. I'm still quite kind of keen. You start with knowing what it is that you want to shift. You get people that are ambitious to be with you. And some of it does rely on national funding, but I think there's more that institutions can do in terms of the tone that we set when we employ not just entry-level jobs, but actually development through the organisation and the messages as organisations we have about the value that we give to local experience and lived experience when we're creating those more senior jobs. And actually, I think over time that starts to shift it. Because the final thing I'll say is the last thing that I would want to do. We've seen it not just in some areas of the city, but some bits of the region. We're really good when it comes to entry-level jobs. We've worked really hard around apprenticeships, but actually, what about mid-management? What about senior management? Where are we recruiting from place on some of those agendas?
Yeah, no, that's important. Yeah, that kind of other layer. Yeah, exactly. That's the next step to all of this. Yeah, Kathy, did you want to come in?
Yeah, I just think, you know, it's always a challenge, that idea of doing things across the whole programme. I suppose that's why when we revamped the Health and Wellbeing Board, we didn't just look at that on its own. We looked at the ICS and how they work together, and we decided we tried to think about where the best conversations, what best actions could happen in different settings. So we kind of took this big strategic sort of approach, and I think what we've really done is kind of created what we hope is almost an organisation around the whole of Suffolk that has fuzzy boundaries between us. Really, that's where that sort of thing, and we're trying to really focus the Health and Wellbeing Board on the wider determinants. That idea of having a proper project group that actually looks at good work and actually brings, as you say, the Chamber of Commerce, brings the LEP into that, it brings Suffolk growth into that, but it also brings things like the poverty strategy into that too, and our anchors work, and also how do anchors work with the smaller guys, you know, the SMEs, how do we shorten their supply chains? I remember the Chamber of Commerce guy said I was the weirdest public health doctor who's ever met because I talked about short supply chains. So, you know, but again, that's kind of spreading the love. And I think what Bev said about progression is really important, because we tend to say it's great, we've got people in these organisations, but how are they progressing? How are they mentoring them? How are we working them so that actually that lived experience that people have? And again, that's something we've really been keen on. It actually grows our organisation in a better when we get different sorts of organisations that are not cut off from their communities, but they're kind of, again, as permeable membranes between them, really. So, you know, the communities coming in actually developing those organisations that can be health, social care, a range of things. So I really love what Bev said there. So yeah, absolutely. Thank you.
Thank you. Yeah, Kevin, would you like to come in?
Yeah, just quickly, there's a piece of work developing out of Essex Anchors Network. Really, it's called the Public Sector Academy. It's very much in the foothills, but that sense of trying to share where we have across the public sector bodies in Essex, which are fairly numerous, where we have the vacancies, where the commonalities are, and actually whether we can figure out a way of getting to the point where we are perhaps either hosting or offering something that is, if you like, coterminous to all those bodies in terms of vacancies. I think some of the challenges potentially in the detail, and particularly for us as Mid and South Essex Foundation Trust, yes, we will have a range of entry-level jobs and beyond that are common to all of that space, but equally, we may be the only ones who are offering vacancies in our sterile services and our decontamination. I don't want to be quoted on that, but I think it's the sheer breadth of our NHS jobs that might mean that we can't embrace that totally and fully, shall I say.
Yeah. Thanks, Kevin. Yeah, that's great. I don't know, colleagues from Scotland, is that community planning partnership architecture an easier way to do this? Could we create this kind of this total bank of jobs? I don't know if anybody colleagues from Scotland want to share on the potential of that.
Yeah, I can come in there, John Ross here. I'm not sure, I'm not directly involved in community planning partnerships, as I said, on the other side of it. But I really think there's an awful lot of potential for our community planning partnerships, which have all our national health boards within the partnership themselves, to have a look at the ideas that have been given here today, because I haven't heard of a lot of the ideas that have come forward. I'm not sure if that best practice is shared amongst health boards in Scotland. I would imagine some of it is. We have integrated joint boards, which are also represented within the community planning partnerships. As I say, these bodies have members from every organisation round, from business through to third sector, fire and police. Everybody seems to be involved on these sectors, and it's certainly something that I will be taking back from this afternoon. If I could possibly ask a question of Bev, because as I say, we recently started our Community Wealth Building Commission, of which I chair, and we're talking to 3 large anchor institutions, 3 large hospitals we have within Lanarkshire, and obviously we've run up against a problem where most of the contracts that they have been in place for some time, and there's no way that they presently can get out of these contracts. How long did it take your anchor institutions to realise the full benefit of community wealth building and start to change their opinion of both, one, where they procure services from, and secondly, the type of employment strategy that you're probably now taking on board? And that probably applies to Sandra as well, when she spoke about what they're doing as far as the way they're employing people now. I would love to know. Thanks very much.
Do you want me to jump straight in? I'll be brief as I can, and then I'll let Sandra come in as well. So I'll be really honest, I don't think anywhere is completely there. And I think that's why this conversation is important. I think we've seen progression as we've worked much more closely together in the city as a local authority and a health service. And we've seen that through some of the, I think there are some opportunities of integration. I think that the partnership arrangements can actually lead to decisions being made that shift some of that. So if I think about Manchester, we set up a public sector joint delivery health and care integrated organisation, and we also merged the City Council with the CCGs in terms of Manchester Health and Care Commissioning, been able to connect into those historic conversations around the social determinants of ill health that GPs see every day in their surgery, with decision making in the city that then leads into commissioning, that then has a conversation that says, well, actually, ultimately, and I really briefly, we took a decision where actually as a health service, we invested more money into our home care, including paying the real living wage. So it costs us just under £2 million just each year to pay the real living wage for home care workers. But that actually came, don't tell the NHS on me, but that came through the integration of health and care budgets, where actually health sector partners realised that a sustainable home care market that supported people at home, we did the modelling right down to the number of UTIs that we could prevent that would stop admissions. So I think what I'd say is leadership in a place, but also knowing how organisations respond. And for acute health trusts, actually being able to map what difference an intervention can make was a way to unlock some of the purse strings.
Thanks very much, Bev. Presently here in South Lancashire, we do pay above the real minimum wage health and social care. So yeah, just thought we'd throw that in. Thank you.
Sandra, I don't know whether you had any quick reflections on that.
Yeah, I think from a recruitment perspective, I think it's been a huge turn for us. We've actually got a community of practice next week, I think it is, where we are actually brought together all our local councils, our local colleges, and we've got our new chief exec that started last week. And one of our asks is that we relook at our recruitment and how we do it as an organisation. Because, if you always do what you've always done, you're going to get the same results. But actually doing this programme and looking at the success of the young people that we've recruited on potential, the stats prove that actually it works really well. So I think our ask will be next week to the chief exec and to our local organisations is, let's relook at this. Let's look at examples of the people that have come through it to make sure that they're getting a great experience through it rather than a headache, to be able to go through the recruitment process.
Great, thanks, Sandra. Rachel, do you want to come in? We've obviously just worked with you in Dundee, and we've reflected on a lot of this stuff. Yeah, I don't know whether you wanted to come in.
Yeah, it was actually back to your community planning partner kind of point, and I think there is no doubt that it's beneficial that our anchor institutions already work together across these kind of areas. I have to say though, I think what we're currently struggling with is that kind of decision on whether or not to set up separate in terms of community wealth building boards, community wealth building institutions, or to try and use what we already have. The obvious benefit of what we already have is that organisations are used to working together, establishing at a senior level. The issue is that they're really busy and they have such wide agendas that the danger of just tagging something as big as this onto it is that it'll just get lost. So I think in some ways I kind of I imagine that a lot of the English authorities are kind of jealous in terms of the structures we have in Scotland, and it is good in some ways, but I think we are right in the middle of that now. We are right in the middle of deciding, what do we do? Do we try to tag on to what we have, or do we set up something different? And then the issue is that because community wealth building is so broad ranging, it then cuts over a lot of the things which already exist. So yeah, it's not an answer. It's just a kind of a comment, I suppose, that is what we are currently scratching our heads about in Dundee and trying to decide the best way to progress.
It's a very helpful comment, I think, Rachel, because it shows, doesn't it? It's like Scotland, you can flip it around, conducive national policy frameworks, but it's like everyone's got to do the real work on the ground, right, to try and make this stuff a reality. And that's, I think, I think what we've had a sense of today is just like what that actually involves, at a granular level. And it's still, and I suppose it is trying to unify and put more of a process around this, because it's, it seems a lot like the work of some fantastic individuals and individuals with passion and intent and a real desire to do something different. And we've got to try and find a way to get our processes to catch up. So it's not individuals having to make these brilliant leaps, and, it needs to be more uniform, I think. And that's a take home for me anyway. I'm conscious of time here, and this has been a fantastic discussion. We could go on for hours probably, but it's been great. And so I just want to say a huge thank you to Councillor Bev Craig, to Sandra Jones, and to Sharma for kind of sharing those kind of inspirational examples. and to you all really for kind of getting involved in discussing this and thinking about how we can push it on. Our door is always open. Do come and talk to us if you want any more advice, if you want to have a chat about any of this. We're always here, so do get in touch. But yeah, brilliant to kind of have the pleasure of being in your company this afternoon, and yeah, thank you, and I hope you enjoy the rest of the summit. Cheers. Thanks everybody.